The following videos demonstrate how to operationalize patient-centered counseling about reproductive goals and contraceptive preferences using the PATH framework. This framework is a concrete set of open-ended questions and counseling skills designed to effectively engage with patients about their reproductive goals and, when appropriate, pre-pregnancy care, contraception, and infertility services. PATH is an acronym. The PA stands for parenting or pregnancy attitudes, the T for timing, and the H for how important it is to prevent pregnancy. PATH asks the following 3 questions. For the PA, do you think you might like to have children at some point? Or if the person's already had children, do you think you might like to have more children at some point? The T, when do you think that might be? And the H, how important is it to you to prevent pregnancy until then?
Good morning. My name's Cassandra.
Hi.
Nice to meet you. And you're Alyssa?
Yes.
All right, great. Can you go ahead and give me your last name and date of birth?
Yep. It's Peterson and November 13th, 1989.
Okay, great.
Cassandra proactively apologizes for Alyssa's weight. She takes responsibility, is not defensive, and focuses on Alyssa's experience.
Thank you so much for waiting. We had a patient earlier this morning that needed some extra time. I hope that this didn't mess up your day too much.
Oh, no, actually, it's fine. I had a chance to look at the chart and look some stuff up on my phone. And honestly, it's nice to just take a break from my life for a minute.
Well, I'm just going to log in here, okay? It'll just take a moment.
Cassandra is efficiently using the time while she is logging in to ask about Alyssa's life. This small talk can fit into the nooks and crannies of the visit, time that could otherwise be wasted.
So tell me about your life. Are you working or in school?
Or both. I work as a server at night, and then I'm a student full-time right now, and I'm actually studying to be ultrasound technician.
Oh, awesome.
Cassandra builds rapport by remarking on the fact that Alyssa will be working in healthcare and then validating her determination. This is pointing out positives. Notice the many more instances where Cassandra points out positives in this vignette.
So you'll be joining us in the wonderful world of healthcare.
Yes.
Welcome.
Thank you.
I've actually heard that that's a great career. But how do you juggle it all, work and school? I mean, you must be quite determined.
More like I've just had a series of crappy jobs since high school, and I don't know, I just need to do this for me.
Well, I see here that you're here for a well woman visit. Is there anything else that you'd like to talk about today?
No, I think that's it. This is my first PAP, and I am like 100% not looking forward to it.
Cassandra's face, body language, and words show no judgment about the tardy PAP and show full acceptance of Alyssa's disclosure. Cassandra then gives positive feedback and demonstrates empathy.
And I know I should have come in a long time ago, but I'm gay and I didn't think that I needed this kind of a test. But then a friend from school told me that I should come in, so.
Okay. Well, your friend is right, and I'm really glad that you decided to come in today. I can see that this isn't easy for you. We can go through each step of the exam so you know what to expect.
Rather than making assumptions, Cassandra asks Alyssa about her concerns. This is followed by validation and a positive statement. Cassandra then gives information and a follow-up question. Cassandra uses follow-up questions after she gives Alyssa information throughout the vignette.
Is there any part in particular that's concerning you?
Well, it's super embarrassing.
I get that a lot.
And it doesn't hurt too much, right?
You're right. So most folks say that they feel pressure, but that doesn't actually hurt. Okay. Is there anything that you found in the past that makes things like this that might be hard easier?
Just knowing what's going to happen ahead of time and knowing who's going to be doing it.
We can go as slow as you'd like. I can stop at any time. And if you think of anything that I can do to make this easier for you, please let me know.
I will. I think I'll be fine, though.
Part of today's visit is us going through some reproductive health care questions together. Are you okay with that?
Yeah.
Cassandra asks PATH. No adaptation is needed for Alyssa's sexual orientation other than to ask in a non-judgmental and non-gendered way about exposure to pregnancy.
Do you think that you might like to have children at some point?
No. Yes. I would like to have a kid someday, but I'm hoping that my future partner would be the one to carry the baby. I just don't really see myself enjoying pregnancy.
Okay. And do you know when that might be?
Well, I have to find a girlfriend first, so there's that. But once I'm done with school, I should be able to support a kid, so...
Okay, well, it looks like you've put some thought into this. Now, I don't want to make any assumptions, but I don't know if you ever have sex with anyone with whom you could become pregnant. And if you do, how important is it for you to prevent pregnancy until you finish ultrasound tech school?
Yeah, no, actually, I do. I have a friend, and we both have a little, bedroom rodeo whenever we're both single. But honestly, it wouldn't really be the end of the world if I got pregnant.
Okay.
Cassandra paraphrases and offers relevant services based on what Alyssa has said. Note the phrase, ways to be prepared for a healthy pregnancy, with no mention of the word plan since Alyssa did not say plan.
So I'm hearing you say that you'd prefer to prevent pregnancy now. So would you like to talk about options for contraception?
Sure.
I'm also hearing you say that you don't completely oppose the idea. So if you'd like, we can also talk about ways to become prepared for a healthy pregnancy.
Maybe let's talk about the birth control, because I truly don't actually want to get pregnant.
Okay, fair enough.
This question focuses on Alyssa's preferences for particular characteristics of a method rather than on which method. Later, Cassandra will ask, and what else? Until a clear picture of Alyssa's preferences emerges. Cassandra will offer to discuss methods with the characteristics Alyssa has said are important to her.
Do you have any sense of what's important for you in a birth control method?
I was on the pill in high school, and that was great for my skin, so there's that.
You're right. So birth control pills can definitely help with acne. So can the birth control ring and the birth control patch. Anything else that's important for you in a birth control method?
My last girlfriend had really bad periods, and they told her to take the pill to completely stop them. And I mean, mine are okay, but if I had the choice to stop them, I totally would. Every month is just this reminder of what a drag it is to be a female.
Okay. I hear you. It sounds like you actually know some of the extra things that you can get from a birth control method. And it also sounds like you're pretty clear on what you want.
Yeah, I look things up, and I mean, even though my school doesn't really focus on these issues, I'm learning how to think about my health and my body in a different way.
So it sounds like your priority is to choose one of these methods here. So to help with acne, we can use the pill, the patch, or the ring. To skip your periods, we can do that safely with either the pill or the ring. Okay? You'll notice here that these methods we're talking about are on the second row of the chart. What that means is they work pretty well, but not as well as the ones here on the top line. Okay, and that just has to do with us being human and how we use them, typical use, okay? But we can get more close to these effective numbers the more perfectly that we use these methods, okay? So it sounds like we want something to help with acne, to help skip your period, and you're also okay with the level of effectiveness. Do I have that all correct?
Yes.
Great. Now, is there anything else important to you? For instance, if you choose the pill, it's something you'll have to remember to take every day. If you choose the ring, it's something that you'll have to put into your vagina and change once a month. Are you okay with either of those? Do you prefer one over the other?
Well, I use tampons, and as long as the ring doesn't hurt or feel weird in any way, then I would be okay with putting that in. Is one better than the other?
Not necessarily. They're very similar, actually. They both have a mixture of female hormones, estrogen and progesterone.
Cassandra uses an anatomy chart and previously an effectiveness chart as visual aids.
They both actually keep the egg in the ovary here, so it can't leave out here to meet the sperm. Actually, it's just the way that you use them that they're different. How do you think you would do if you had to take a pill every day?
Oh, I'm sure I'd be fine with that, but the ring does seem easier.
Okay. Would you like to go over the details of how to use the ring?
Is there a lot to know?
Not really. Mostly, the instructions that you'll get with the ring are written for somebody that does want to have a scheduled once-a-month bleed, like a period. Since you'd like to skip your periods, what I would recommend is you put the ring in the first day of every month, keep it in for that full month, and on the first day of the next month, take out the old ring and replace it with a new ring.
So it's like paying your rent.
It's exactly like paying your rent, except you actually get to save money on tampons. Would you like to start today?
Sure. Today isn't the first.
You're right. So it's not the first of the month, but it is actually safe to start the ring any day as long as you're not pregnant. Is there any chance that you could be pregnant?
Not unless my sex toys can get me pregnant.
Not the last time that I checked. So you can go ahead and start the ring today if you'd like. You'll have protection once it's been in for 7 days. Each ring has enough hormone in it to give you protection for at least a month. One way to think of it is that each month gets a ring. So this ring would belong to February, next ring would be for March, the next would be for April, and so on. The reason we offer the first of the month way to change it is just because it might be easier for some folks to remember. Okay. What we can do, I can give you a ring today. You can go ahead and put it in, and if you have any questions, I can check it. I can have you put it in right after we're finished with the exam.
Sounds good. I don't think I'll have a problem, though.
Okay. I don't think you will either. Some people do notice some bleeding or spotting in the first few months as their body's adjusting to the hormone. If that happens, you can go ahead and take the ring out for 4 days, have a little bleed like a period, and then put the ring back in for the rest of the month. How would you feel about that?
Does that mean that the bleeding would stop after that?
Usually it does, with removing the ring and then putting it back in. Okay. If you do need to do that, it's really important to make sure that you don't leave the ring out for more than 4 days.
Okay. So, on to the fun part?
Yes. Before we get there, Alyssa.
Cassandra uses Teachback. Notice how she points out that Alyssa could handle more information than usual. Cassandra takes the responsibility on herself by saying she wants to be sure she didn't leave anything out, rather than appearing patronizing.
I felt that I could give you a ton of information, more than I usually do, but I want to make sure that I didn't leave out anything important that you need to know. So can you please tell me how you plan to use the ring to skip your period?